Here's research on the efficacy of turmeric extract of curcumin for alleviating the symptoms of joint arthritis. And again, this is another review. In this study, the conclusion of the review of randomized controlled trials provides scientific evidence that supports the efficacy of turmeric extract at about 1,000 milligrams a day of curcumin in the treatment of arthritis. Now, I want to show you this diagram that shows some of the biomarkers that improve and that are being measured and that show improvement. So what you're looking at here is, in this kind of light orange color, you're looking at the placebo group. In the red color, you're looking at low doses of, and that low dose, that's 250 milligrams of complete turmeric matrix supplement. And then we have a high dose group taking 500 milligrams. And so what the two primary things being measured, or primary outcomes being measured here, were C-reactive protein and rheumatoid factor. And again, both of these are markers for patients that have autoimmune arthritis, particularly rheumatoid arthritis. And so what you can see, and then this third marker here, erythrocyte sedimentation rate, which is a marker for inflammation, just like C-reactive protein. So in the placebo group, you can see 29.6% improvement taking a placebo pill. But in the low-dose turmeric group, you get 81% improvement over the baseline, and then, 88%, 88.1%, and then in the higher dose group, you get 88.6% improvement in erythrocyte sedimentation rate. And so this is what does this translate into? What does that mean? That means when you get an improvement in ESR, that means that translates into a reduction of inflammation. Remember, turmeric has anti-inflammatory properties. And the C-reactive protein marker for the placebo, they got worse by 11.3%. In the low dose group, there were almost 30% improvement, and in the high dose, there was 51.2% improvement from baseline on C-reactive protein. And then we see something similar over here in rheumatoid factor, 13% regression in the placebo group, whereas an 80.2% improvement in the low-dose group and an 84.2% improvement in the 500 milligram a day turmeric curcumin group. So again, clinical biomarkers that are commonly used by rheumatologists and other types of doctors to measure the progression of disease in autoimmune arthritis. So the review of trials, human trials that is, on using turmeric extract as a potential to treat arthritis are very promising and very good. I see this very frequently in my practice, where turmeric is commonly used as a natural anti-inflammatory when we're trying to get people's diet and lifestyle under control. Because remember, you can take turmeric supplements, you can take curcumin, but if you're not addressing why the inflammation exists, you're using the supplement as a mediator of inflammation, but you're not really figuring out why you have the problem. So again, the point of that is, if you're using the supplement to reduce your inflammation, you should also be simultaneously looking for the origin of why your inflammation exists. Now, this is a review paper published in Frontiers of Nutrition here recently on different human trials that were studied in different types of cancer. And so you can see here prostate, head and neck cancer, breast cancer, pancreatic cancer, as well as colorectal cancers, human trials, and all of these things that showed good results. And you can see that in prostate cancer, 0.1 grams, which is 100 milligrams rather, a day for 6 months, reduced serum PSA. That's with curcumin use. We see head and neck cancer. You've got curcumin inhibited the kinase activity and interleukin-8 levels in head and neck cancer patients. Again, this is a reduction of inflammation. In breast cancer, 6 grams a day for 3 weeks, recommended dose. And clinical responses were definitely observed in these patients. Pancreatic cancer, there were improved outcomes in pancreatic cancers using a mixture of different chemotherapeutic agents as well as curcumin. So, and in this study, you can see, look at the dosing here, up to 8 grams a day. So, if you go over the counter and buy a supplement that contains curcumin, most pills are going to contain about 500 milligrams per capsule, these guys were using 8 grams, which would be equivalent to about 16 pills a day. So that's a big load. And in some of these trials, what they found was because it was so many pills that the actual compliance rates went down, but still good results. And then you can see down here with colorectal cancers, you've got anywhere from 0.4 to 2.2 grams a day for 4 months. And then in some of these as high as almost 4 grams a day for months. All of these showing positive clinical outcomes and positive clinical benefits in folks with colorectal cancer. And again, these are human trials, not animal trials. So what a lot of these researchers are saying, when they're publishing their work, is they're saying we're seeing better outcomes and better results, but they're also saying we need more research. In other words, there's not enough pooled data for them to confidently say everyone with this type of cancer should be on, curcumin extract as a method of helping fight that cancer. You can see here, curcuma longa and curcumin affect respiratory and allergic disorders. And so you see the preventative effects of extracts of curcumin were shown in experimental animal models of different respiratory diseases through antioxidant, immunomodulatory, and anti-inflammatory mechanisms. Curcumin also showed preventative effects on some lung disorders in the clinical studies. So again, we've got human trials, we've also got in vitro trials or in vitro studies. So both, there's evidence that, that curcumin is an anti-inflammatory, antioxidant, anti-cancer, has mechanisms in all those different ways, has antimicrobial effects. All types of trials, both animal studies, both petri dish studies, as well as in actual human trials. So the growing research and evidence around curcumin is becoming more and more common. We're seeing more and more benefits showing up in these clinical trials. And so it is definitely something, if you struggle with any of these types of conditions, you might want to have a conversation with your doctor about whether or not, taking a curcumin extract is going to be something that might be right for you, or in the case of something that might help you. Now, one of the questions that comes up frequently is, or concerns that comes up frequently, and this is especially true of those of you that have a history of kidney stones or have oxalate issues, because turmeric is a high oxalate plant-based food. But I want to point out some of the things, because a lot of people are fearful of using curcumin, and the studies actually show that using a concentrated curcuminoid type of supplement does not contain large quantities of oxalate. So let's break this down. 1 gram of whole turmeric contains about 20 milligrams of oxalate. Now, if you're trying to follow a low oxalate diet, that generally means that you're trying to stay under 50 milligrams of oxalate consumption per day in your diet. And so if you're consuming a gram, and a gram's not very much, we're talking about whole turmeric. So we're talking about whole turmeric powder or turmeric food itself is a very high oxalate hit, because 1 gram contains about 20 milligrams of oxalate. However, oxalate levels are much lower in standardized turmeric supplement products. It's important that you understand that difference, because many of you have been scared away from using turmeric for this reason. So using large amounts of whole food turmeric can potentially elevate oxalate levels, and there have been research studies that have shown that. Using standardized supplement doses at 1,000 milligrams a day or less equates to less than 1 milligram of oxalate. So if you were taking a supplement and you were taking 1,000 milligrams a day and you were trying to stay under 50 milligrams a day, that supplement would equate to about 1 milligram or less per day of total oxalate exposure. Not a high amount. Now, there was some research done a while back that somebody, I can't remember who it was online, talking about it, but again, it put a lot of, in my opinion, unnecessary fear on people. This is total soluble and non-soluble oxalate content. This is a research study where they're actually analyzing it. And you can see here I have highlighted turmeric powder, again, which is a whole food form, can contain total oxalates of almost 1,900 per 100 grams. So that's, again, this is per milligrams per 100 grams of total oxalate. So again, we're talking about much lower doses than that, and not using food, but using standardized supplements. As a matter of fact, there was a supplement company, I think it was last year, that came out and actually tested their products and found that their 1,000 milligrams of their product contained, it was somewhere like, I think it was like 0.44 milligrams of oxalate. So bottom line here, if you're considering using curcuminoid supplement as an anti-inflammatory, don't fear the oxalate. Now, if you're doing things like taking whole turmeric powder and making golden tea, or using an abundant amount in your cooking or your food, and you have an oxalate problem, that's where you might run into trouble. But again, if you're using the supplement, not so much of a risk. Here's that study I was referencing a moment ago, and you can see the consumption of supplemental doses of turmeric can significantly increase urinary oxalate levels, thereby increasing risk of kidney stone formation in susceptible individuals. This was published in the American Journal of Clinical Nutrition. But you have to take into effect whether you're using turmeric, the food, versus whether or not you're using the actual supplemental curcuminoid that do not contain anywhere near the quantity of oxalates. Who else should be cautious with turmeric? There are a couple of groups of folks that just want to go in to taking higher doses of curcumin with caution and preferably with good guidance from their doctors. And that one is the individual with gallbladder disease should be cautious. Now, I say gallbladder disease, not an absence of a gallbladder. So if you've had your gallbladder removed, this does not include you, but it's individuals that have gallbladder disease, gallstones, or what's called cholecystitis. Cholecystitis is inflammation of the gallbladder. High doses of, again, this is turmeric, not curcumin. So turmeric, high doses of turmeric, has the potential to trigger biliary colic. So it can actually trigger the gallbladder to contract. And if you've got stones in there, that can make you much more symptomatic. Now, this is if you're using high doses of turmeric, and not so much if you're using supplemental curcuminoid. You have to get really, really high. And I think in some research, it's like 20 grams. 20 grams a day is going to create a gallbladder contraction. And so supplementally, not so much a problem, but with turmeric, again, the food-based turmeric, you want to proceed with caution. Now, one of the other impacts that turmeric has that we haven't really talked about yet is it has an effect on blood clotting. So it can actually serve to reduce inflammation in the bloodstream and serve as a blood thinner, as a natural blood thinner. So if you're taking a blood thinner, you need to basically get with your doctor, your prescribing doctor, and talk about that and make sure that, if you're going to add turmeric supplements or curcumin supplements to your repertoire, that your doctor's aware of it and approves it and is monitoring you, and you also want to monitor yourself. So if you're getting too high, one of the things you're going to start seeing is pooled blood vessels in the skin. So you might have big, dark, kind of red, purplish bruises popping up all over your skin. If that's happening, your blood's getting too thin, and you should really talk to your doctor. But again, you shouldn't go into high doses of this stuff if you're on a blood thinner or you have a bleeding disorder without good medical follow-through or guidance.